IDSR in Tamil Nadu whenever you have an opportunity to come here. So this topic is basically on research, and before we go into research, I really wanted to tell you basics of research here. So education is not the learning of facts, but the training of the mind to think. And this program is a classical example of this particular thing, because it's not about textbook knowledge, it's not about just theory, it's not about practical, it's not about just research or anything, because we need an orientation for the first year postgraduate students to understand what PG is all about. And this particular topic I thought would suit this particular presentation. And that's why I started this presentation with Albert Einstein's quote. The topic given to me is essentials of research. Essentials of research, when I say that, I think research is what everybody else has seen, but to think what nobody else has thought. So you see whatever everybody else has seen, but then you think differently. The thought process has to be completely different for that. So I usually title this presentation as Researching Research, because this is something which everybody else has seen. Your faculty have seen, your classmates have seen, your seniors have seen. Then we want you to see this from a different perspective. And that's what we're going to do this. Some of the common words which we use in post-graduation is thesis, dissertation. So what is the basic difference between a thesis and a dissertation, right? What you do as a postgraduate student is not a thesis, which is misused most of the time. It's a dissertation, which is something already done in a different setting. Maybe something was done in USA or Europe, and you are trying to do something very similar in an Indian setting. You might change the parameters a little bit, but you're not finding something totally novel. A PhD work is considered a thesis because it has to be totally new, has to be novel, and they have to tell something new to the whole world. The word efficacy and effectiveness is also interchangeably used most of the time. I think as postgraduates, you have to be careful in using these two words. The word effectiveness is what we generally do. We allow a child to use a toothpaste or a mouthwash, and then we look at the dental caries status after 3 months, 6 months. Then you are looking at the effectiveness of that particular toothpaste or a mouthwash or a drug A or B. But when we use the word efficacy, it is in a closed setting. If you give the same drug or a toothpaste or a mouthwash to the students, these students have to be put up in a hostel. In a closed setting, they have to be monitored. They have to use the same kind of oral hygiene measures, oral hygiene practices, the same kind of food, the same kind of snacking. So it is in a closed setup. So in vitro trials, laboratory kind of work, when we do, it can be an efficacy trial. But when we do in patients, we allow them to do their routine. Then it becomes an effectiveness trial, right? References and bibliography, again, is kind of interchangeably used. Whatever you have read to understand this particular concept is bibliography, right? But whatever you cite in your paper, if you write a manuscript, if you write an article, if you write your dissertation, whatever references, when you write the word references, you have to cite whatever you have referred, right? So there might be 150 articles which you have read to understand this concept, but you will be citing only 100 articles. The bibliography includes all the 150, but reference includes only 100. So welcome to research, because I want you to understand in research, the choice of word becomes extremely important. Bottom line, it's very difficult to do research without errors, but we have to try and minimize these errors so that we find something meaningful. Okay, so that's the introduction which I wanted to tell you. What is research to you, right? So for me, research is curiosity. When I say curiosity, I also add the word formalized curiosity. You cannot be just curious and then find out something and then report something, right? My PhD work was on oil pulling therapy, which was done in 2005 to 2009. When I started oil pulling therapy, people used to say, what is this concept? And people used to say it works. A lot of testimonials are there that it works. Testimonials cannot become research. So we had to tell the whole world that so many thousands of people and lakhs of people were using oil pulling therapy. But that is not considered research. Research has to be done with a specific protocol. So it has to be a curiosity, but it has to be a formalized curiosity. It is poking and prying with a purpose. You have to have a research question. For research, the basic thing I want you to understand is identifying a research problem. So if you have a short study for a conference, if you have a dissertation to make, the first thing as postgraduates you do when you do your journal club, seminars, your discussion with your seniors, discussion with your faculty, identify a lacuna in the knowledge, existing knowledge. Identify a gap which is existing in literature right now. So there is something missing here. There is a missing link There's something abstract, there is a missing connection there. Identify the research problem. If you want to do good research, identifying the research problem is the first important thing. The first take-home message I ask you to do is identify the research problem. Once you have a problem, go and search about it. See what is spoken about that particular research problem. Has everybody answered that question? What question came to your head might have been answered by somebody in Europe or Australia or USA. So I do a literature search, define the problem. There might be partly answered, some of it is still not answered. So define the problem, do a proper research plan, then start doing the research. Then you do the data collection, data analysis, interpretation, then you write. Okay. So I'm going to add one more to this particular slide. First, when you want to do research, once you have identified the problem, you have to write the protocol. I think it's mandatory these days. I think AI will help you write all protocols. It becomes easy these days. But when we started doing research, it is very, very important that we write a protocol. Writing a protocol is the foremost thing. Don't think that it's a simple task, but you have to write it out. You have to jot down all the points which you want to do. Look at the need for the study. What is known or new, right? So I already told you that this is just an addition to the previous slide. Identify the research question, write a protocol, do the literature search, look for the need of the study. What is the rationale? Why am I doing the study? Right? A rationale for the study just means literature search says that so much of information is already existing. So much of lacunae is there. There is a gap in the existing literature. My research question can try to find an answer for this gap. That is what you have to find out. For doing a good research, when we have a question, the first thing you need to do is the study design. So you will look at the study design next. When you have decided the study design, you should immediately contact the statistician. I want you to understand in research, the role of the statistician becomes extremely important. The statistician does not come at the end of the study. You don't go to the statistician after you finish the study and tell him, do my maths for me because I am a science student, and then give me the data. That is not what will happen. You should not be doing that. You should be talking to the biostatistician, telling him that I have a research question like this. I have a study design like this. I'm expecting the data to arrive like this because I'm using some tools. I'm using some methods. This methodology will give me data like this. So the data could be a quantitative data, qualitative data. So if I want a stringent result, which will tell me to actually find the difference, what number of patients do I need? What number of samples do I need? So the role of the statistician starts when you do the research writing. That means that's why we write the research protocol. Identify the question, talk to your statistician, define your methodology, then the role of each member, because there are multiple people involved in research. It's not one person. Unfortunately, yes, in India, it is your dissertation, you do the work, but you will need some support from your juniors, your seniors. So the role of each member has to be identified. You also have an institutional review board, which will define and refine your methodology. They will ask you a lot of questions about it. Ethical aspects, you have to look at ethical aspects because there might be some ethical aspects included. So you have to be very careful about that. So you have to have an ethical clearance. You have to do, if you are doing an interventional study, you must include a trial registry, right? Clinical trial registry of India, CTRI. So you have to register your trials, even if it is a small research, even if it is an observational study. You are only doing it. You're not intervening. You are not trying to do something. Even PG dissertation, CTRI has made it mandatory. They have a separate link where PG dissertation can be submitted. So do not avoid a CTRI if you want to publish your papers later. So IRB, IEC, trial registration has to be done. Funding, obviously, you should know where the money is coming for the research. Think about feasibility. When you are a first year postgraduate student, choosing a topic could be something tricky. Your seniors can help, your teachers can help, and then you think about a topic. Then what happens is by the time you come into second year, later second year or third year, this topic might not be of real interest to you. So identify a topic which is possible, feasible in your area. Sitting in a small place near Salem in Tamil Nadu, we might have to travel to Coimbatore or Chennai to get certain work done. So if my PG does not want to travel, then I will tell them, don't do the study here. So feasibility of research is extremely important. I think PGs have to understand that. Okay, so let us quickly do certain parts because I've been asked to touch on study designs, the epidemiology. Epidemiology is the study upon people, right? So in epidemiology, I just want you to understand that we have different study designs, and I want you to understand each study design has important protocols and guidelines to be followed, which I will be mentioning. You have to follow the guidelines mentioned for each study design. So when you write a protocol, you will say that this study design I'm using, so I will be following this particular protocol which defines the guidelines for that particular study design. So I mentioned two words here. Once you find a research question, you decide your study design, you talk to your statistician. Once the study design is decided, you have to follow the guidelines for that particular study design. So basically we divide them into observational studies and experimental studies. Observational study is also called as non-interventional. That means as a researcher, you are not intervening. You go to a school and observe what is the caries status of children in the school. You are observing the caries status. You are not intervening. At the same time, if you go to another school and find there is so much of caries, and you say, I will give them a toothpaste, I will give them a mouthwash, I will follow them for 6 months and see what happens to their caries status, you are intervening there. That becomes an experimental study design. So basically, interventional, non-interventional, also called in most of the textbooks as observational. Observational means non-interventional. Experimental means you are intervening there, right? So this observational study can be descriptive. Again, I will go to the same example. I go to the school and I'm looking at the caries status. I'm looking at the gingival status. So that is, I'm just describing what I have seen. That is a descriptive study. Look at this analytical. I'm looking at 3 schools and I'm looking at school A, school B and school C. And I look at the caries status and I'm saying school A has more caries than B and C. So I'm only thinking, why did school A have more caries than B and C? They had a longer break time, they had a snack break, there was a canteen, children were allowed to bring snacks, they were not brushing properly. So I'm trying to ask some questions to find out what I have observed. So descriptive will just explain whatever I have seen. That is just purely observational. In analytical, after I've observed, I will try to identify why this has happened. So a descriptive cross-sectional study will only try to create a hypothesis. It will only tell me school A probably has more caries because they have a longer break time. They have a longer snack period. An analytical study will help me find out whether they actually have a longer break time. And I will only try to see, okay, they have a longer break time and maybe that is the reason why they're all snacking more. The school doesn't have restriction in snacking. So a descriptive study will generate a hypothesis because it just observes. The analytical cross-sectional study or an observational study will analyze why that observation happened. Okay, so in your PG, you will be doing mostly a randomized control trial, which is an interventional study. The analytical or a descriptive study can be cross-sectional, case control and cohort. So these are the main study designs which you have to understand. But I also want to give a word of caution. A cross-sectional study can be both descriptive and analytical. Because in a school, when I look at the caries status, it becomes just descriptive. But if I analyze why the school had more caries, then it becomes an analytical cross-sectional study. So we'll just keep adding. I know it's just a quick, brief orientation program, but I want you to take the main feelers, right? I'm going to highlight certain things. I'm going to give you some references here and there, and you can pick up this. So as I mentioned, cross-sectional study can be both descriptive and analytical. When I go into a population and look at what is the caries status, I'm finding the prevalence. I'm finding what is existing already, right? I am not finding the number of new caries. I'm only finding the existing caries. Existing caries or existing disease becomes prevalence. Am I able to find out the relationship between the snack period and the caries? I will not be able to directly attribute the school time as the reason for the caries. I can't do that. I can only say, okay, maybe the school time could be a reason for the caries. The school doesn't have some standard operating procedures on the snack habits. Some schools tell no chocolates, no junk. Some schools are okay with that. So maybe one school allows the snacking habits and that is why it has happened. So I cannot attribute a direct cause and effect in a cross-sectional study. A cross-sectional study is also called as a chicken and egg phenomenon. A chicken and egg phenomenon means which came first. Did the children have more caries and then started eating snacks, or because of the snacks, the caries came? right? So we don't know which came first, which happened first, which came later. So it's called a chicken and egg phenomenon. It's also called a snapshot design. It's just going and taking a picture. I go to school, I can take a picture. I go to another school, I take a picture. If I did the same dental caries prevalence study in 2015, and if I do that again in 2020, and I do that in 2025, I might get different results because I'm only taking a snapshot at that point of time, at that point of time, at that point of time. So it is a snapshot design. That's the thing I want you to do. So how does an article look? When you look at this article, you will see that this article is a prevalence of hypodontia in 9 to 14-year-old children who attended one school, right? So it was published in IJDR. That doesn't mention the study design. But nowadays, we want you to mention the study design. So it will be a descriptive cross-sectional study. 600 OPGs were taken. We are expecting prevalence. Only OPGs were taken, and the study does not mention anything on the title. So in 2010, it was allowed. Now we wouldn't expect that. We would like you to explain how you have done the study, right? It is a cross-sectional study. That means they didn't look at the patient. They looked at OPG, looked at hypodontia, boys how many percentage, girls how many percentage. So they are not finding the new prevalence of hypodontia. Something did not happen new. It is not incidence, it is prevalence. So cross-sectional study prevalence is something which I want you to understand. Look at this. If you have a time frame from January to December, the number of new cases which is denoted by the circle will become the incidence. Incidence increase 3, 4, 5, and 8. 3 is here, 4 is here, 5 is here, 8 is here, because the circle is the time when it is started. So during this time frame, this is where the disease started. But look at this January, look at the prevalence, period prevalence, 1, 2, 3, 4, 5, 6, 5 and 7 and 8. All of it started except 8, except 6. Look at this, 6 started after December 31st. So prevalence means whatever is existing at that point of time. Incidence means what is getting new, the new diseases which is happening in that period of time, right? A case control study. A case control study is usually called a retrospective study because we go back in time. We go back in time. Okay, I'm going to start here. Children with ECC, without ECC. Children with ECC become the cases. Children without ECC become the controls. So we have a case and we have a control. You go back in time. That means in 2025, I have 50 children with ECC, 50 children without ECC. I go back in time and find out why they became ECC children. I'm asking questions to their parents. I'm looking at their records. I'm asking the pediatrician. I'm doing everything possible to find out whether they had exposure to sugar, breastfeeding, what happened, nocturnal feeding, bottle feeding. So I'm asking questions to find out why these group became ECC, why this group did not become ECC. So this is something I want you to understand. You should not make a mistake because a lot of articles get published in case control study with mistakes. We have to go back in time and find out why they became the ECC, why they became the cases. You go back in time and find out why they became the non-ECC, right? I find out many studies which compare normal children with Down syndrome, normal children with autism children, right? So they have 100 children with normalcy, and there are 100 children with autism, okay? And they look at the oral health status, and they say the caries status between a normal child and an autism child is different. That is not a case control study. A case control study should go back in time and identify why they became cases. If it is autism, they have to go back in time and find out why they became autism. And for normal children, they have to go back in time and find out why they did not become children with autism, right? So a case control study should go back to the cause and find out why they became that particular disease pattern. And it is not just findings which you do. So I will be talking about this later again. A cohort study. A cohort study is a group. A cohort means a group of people who share a common characteristics. So I have a group of people right now. I am going forward with them. I took a group of children in Tamil Nadu state and I am following them and I divide them into high socioeconomic status, low socioeconomic status, and I follow them over a period of time. 1 year, 2 years, 3 years, right? I'm going forward and I'm looking at them and finding caries status. I'm looking at them and finding gingival status. I'm looking at periodontal status. So I start with a group of children born in Tamil Nadu and I'm following them over a period of time and I'm getting multiple outcomes. In a case control study, we started with one outcome, which was ECC. I went back in time and found out why they became the ECC. But in cohort study, we always go forward and find out multiple outcomes. So cohort study is not going to be easy. It's going to be expensive. It is going to take a long time. You need large number of subjects because there can be dropouts, but you will find out the new caries, the new gingivitis, the new periodontitis. So it will give you incidence. A cohort study will give incidence. A cross-sectional study will give you prevalence because I saw it at one point of time. A cohort study will give incidence because we are following them over a period of time and you might get multiple results, right? It yields information about more than one disease. It's expensive. It has a long follow-up, large number of subjects needed. It proceeds from the cost to the effect because we are going towards the effect. The effects can be multiple. Okay. Where is the case control needed? A case control is done in a rare condition. Where did they use it? When we found out SARS, when we found out HIV first, when we found out COVID, we cannot tell, okay, I will take a group of people, I will inject them with multiple injections and see whether they will have HIV. I will expose them to multiple exposures in air and I will see whether they are getting COVID. We can't do that, right? We found out people with HIV, went back in time and found out why these people had developed HIV, right? Why they developed AIDS. Same thing, people with COVID, we found out, okay, they traveled somewhere and came, they had this exposure, right? SARS, they traveled from different countries. So this exposure could have probably resulted in this particular disease. So when you have a rare disease, we can't subject them and we don't have time. We only have a very paucity of time and we only quickly go back in time and find out why these people became cases. So there's a basic difference between case control and cohort. Case control looks easy. It sounds very easy to do a case control, but case controls also have their limitations in doing. Then experimental epidemiology, I told you it's interventional. That means the investigator has certain things in his control. I'm going to give the toothpaste. I'm going to tell these children, do this, eat this, brush twice daily. So I'm going to intervene. In observational study, I only observe. Here I'm going to intervene. A randomized control trial does intervention. A randomization does not mean dividing them into two groups. Randomization has different parts which I want you to understand. So you randomly divide them into two groups or three groups. You can have parallel arms, you can have crossover, which might be a little too much for you, but you have to understand it's an interventional study design. You are going to divide them equally into two groups and follow them. So this is my PhD I told you about. I worked on adolescents 15 to 19 years. Oil pulling therapy was the intervention I used. P is the target population which I worked on. I is the intervention which is oil pulling therapy. C is chlorhexidine which was the control which I used. O is the outcome which I studied. And T is the time duration I answered. I took the study for. So that means in a randomized control trial, I want you to do two things. One, answer a PICO question. P-I-C-O-T. What is the target population? What is the intervention? What is the control? What is the outcome I'm seeing? What is the time duration? What are the things I have doing? All this has to be answered for a randomized control trial. You can blind people, right? It can be a single blind trial, it can be a double blind trial. Single blind trial, the participant does not know. A double blind trial, the participant and the doctor who is doing something does not know. So you have different kinds of randomized control trial like inferiority trials, superiority trials, parallel arms, crossover trials, single blind, double blind, which you will be reading a little later. But the second point which I want you to understand about randomized control, one was PICOT. Second is this randomization. Randomization has three steps. One, sequence generation. Second, allocation concealment. Third, implementation. So this is something very tricky, but I want you to understand that allocation concealment and blinding are not the same. Allocation concealment and blinding are not the same. Allocation concealment should be done before the start of the study. Even before the study is recruited, there is a sequence generated, right? There is a sequence which is generated. We have something called table of random numbers. Let us say the example. Let us say that we have two groups, right? One is going to get chlorhexidine, the other one is going to get an oil pulling, right? So I cannot say, okay, all these people who have good oral hygiene, please come to oil pulling so that I will get better results. It's not possible. I have to give equal chances for every child to fall into either of these groups. That means if I have 100 children, I have to divide all of them them into 50-50 into two groups equally. At the same time, every child must get an opportunity to go into the chlorhexidine group or the oil pudding group, right? So we use something called table of random numbers, and that's something which you should do. A coin toss is not acceptable. I want you to understand, because still there are articles written as coin toss. If I do a coin toss, 99 times it can fall heads. If it falls heads 99 times, that means 99 times people should go into chlorhexidine. Only one time tail will go into oil pudding. So coin toss is not an acceptable randomization method. So sequence should be generated with a table of random numbers. Who generated the sequence should not be part of the study, because they know that this person is going somewhere, that person is going somewhere. That is called as allocation concealment. So allocation concealment, randomization, picot is something which I want you to understand. But sometimes it might not be possible to decide that this person has to go into this group, right? So let us say I'm going to divide between cesarean and normal delivery. I can't say first patient you go to cesarean, second patient you go to normal delivery. I can't do that. Sometimes ethically it's not right. Sometimes it is not possible and feasible. Random assignment might not be possible. Still an intervention is being done for a patient, but we know that this therapy might not be enough. Then we call it as a quasi-experimental study design, which I want you to understand. So look at it, cross-sectional snapshot design prevalence. Cohort study is prospective, it goes forward. A case control goes back in time. A randomized control trial and a cohort study goes forward. A cohort is only an observational design. A randomized control trial intervenes. That is something which I want you to understand. So this we call as the evidence pyramid. So when we did PG, our expert opinions, when our HODs told us something, when our seniors told us something, it was considered something like Bible. But now we consider expert opinion as the lowest level of evidence. We have case reports about that, cross-sectional study designs, case controls, cohort, randomized control trials. And above this, we have systematic reviews, meta-analysis, umbrella reviews, which you will be learning in the next few months to come. So you will have a research methodology workshop. So it looks very simple. There are 4 study designs, and you could fit one of your research into one of these study designs. Sometimes reality does suck, because it might not be possible to fit your research, because these study designs were introduced for medical study designs and not for dentistry. We might have to tweak a little bit. We do most of the study designs on teeth, on dummy models, on acrylic models, right, on toothbrushes. So we have to do in vitro trials, and I want you to understand these in vitro trials also are like this. We have to understand, we have a classical example, ISPPD 2005, right? They looked at the retention of the sealant. So they had about 128 teeth divided into 4 groups, 32 teeth each, and they applied sealants, and they found out which type of sealant method where the sealant stayed longer, retention of the sealant. So you will do lots of in vitro trials. Even if you do in vitro trials, please understand it is possible to name or number these acrylic blocks, these teeth or these toothbrushes, and randomly divide them into either of these groups. It is possible that every tooth or every acrylic block or every toothbrush has an equal opportunity to fall into one of these groups, and then you have to do that, right? I have another 10 more minutes to finish, and I will quickly see this. As I told you, the guidelines are important. Once you decided that this is the study design which I am going to do, you have a guideline. The consort guidelines for randomized control trial, the stroke guidelines for an observational study, the care guidelines for a case report. And all this is mentioned in Equitar network. This is another take home which I want you to have. Enhancing the quality and transparency of health research in Equitar network will give you all the guidelines. You can put it in Google and you will still get this. So biostatistics, I told you I quickly want to touch, I only have 10 minutes, but I will quickly finish. The first and foremost thing I want you to understand in biostatistics is approaching the biostatistician at the start of the study. That's a take home 1. Take home 2, what is the data? Always when you do research, think about the tables. I think I always tell my PGs, when you do research, think about how the tables will look. What will the inference look like? If you get this table and if you have this results, how will you interpret and what will the inference be? You have to foresee that. So for that, you have to understand whether my data is a qualitative data or a quantitative data. People use this word categorical, numerical, interval. Don't use that. Just go with qualitative data, quantitative data. Because when you have a qualitative data, statistician will use a separate set of tests. When you have quantitative data, they have a different type of test. So you should understand that when you are given a data which is quantitative, if he gives you back a test which says this should be used for qualitative data, you must have that awareness Must have that knowledge to say there is something wrong. Communication with the biostatistician becomes extremely important. For that, the first and foremost thing is tell him the study design. Tell him what data you will have. Right? Look at this. Your job is not to do this formulas. We ran away from mathematics and became doctors because we don't want to do sample size estimation. So the role of the biostatistician comes in sample size. But I want you to understand that to reduce or minimize errors, which I told you in the beginning also, you must know that there is something like this. There is truth and there can be two errors which can happen, right? There is something called a null hypothesis and an alternate hypothesis. A null hypothesis means two groups are there, group A and group B. Group A and group B are equal. That means they are effective equally on something. Let us say to prevent caries. Group drug A and drug B to prevent caries. Drug A and drug B are equally effective in preventing caries, right? So a null hypothesis will say that both the groups are equal. An alternate hypothesis will say no, drug B is better than drug A. Considering this, there are four options possible. The null hypothesis is represented by HO, means HO is true and you accept it. That means what you told is true and you accept it. There's no error there. H1 is true. That means B is better than A, right? So you rejected the null hypothesis, which means A is equal to B is not right. So two things are right, but there are two errors which can happen, which is called an alpha error and a beta error, which you will understand when you do the epidemiology and biostatistics course, that alpha and beta error convert as your p-value or probability value, which will give you the significant value of the tests, right? So significance of the level will be measured by type 1 error, which is alpha. The power of the test is measured by the beta error, right? So I don't want to take much time, but I want you to understand two words. When you go to the statistician, study design, the data, the alpha value, the beta value, the power of the test, you should tell them. Also, I want you to understand there's something called confidence interval, and you must understand confidence interval. Do not allow the statistician to just give you mean, median, mode, something like that, which you can understand, but also ask him what is the confidence interval. 95% your results have to be confident that it falls here, right? If you get a result, you should be getting an information which you can trust 95% of the time. So you need a 95% confident value, which you should get, which comes to 95% confidence interval. So I'm not doing this like a biostatistics class, but I want you to get accustomed or familiarized with these words like probability value, p-value, the power of a test, 95% confidence interval, data, right? So this is exactly what I told you. If you have a qualitative data and a quantitative data, the test which the statistician will give you will be different. And with this, you will be able to identify that. Before, it used to be mechanical work. Now we use SPSS software. So you also need to ask the statistician what software is being used. So parametric and non-parametric test is another word which I wanted to use. The data has to fall into a Gaussian curve, which you will understand later. A parametric test most of the time follows a symmetrical Gaussian distribution. That when the when the sample is big, when it's large, when it's adequate, it will follow the Gaussian distribution. You end up with parametric tests. In parametric tests, most of the time we use mean values. In non-parametric tests, we use median values. So two things which I wanted to understand: large sample size, normal distribution, right? The statistician will find out whether the data is normally distributed. If it's normally distributed, parametric test is used, and it works based on the mean values. Non-parametric tests are based on median values, and this happens when the sample is not distributed normally. This is something which you have to take home, right? So I've come to the take home, right? I was given about 40 minutes, but I take this flow because I have another 3 minutes. So I want you to identify your research question. Identify a research question. There is a lacuna in research, and I want you to identify the research question. You must be curious, but that curiosity should have a focus. What is the question I have? Am I aligned with my aim? Is my research question giving me an aim? Is that aim being followed in the methodology? The methodology which I have used, is it going to give me an answer to the aim? For this, I will write a protocol and see whether I am tweaking from or whether I am deviating from the normalcy. I have to be aligned to them. So focus, alignment, and curiosity is important, and that will happen when you write the protocol. The role of the biostatistician is very clear, right? So you know that the biostatistician has to be there as a part of your study from the beginning. Statistical helps will be needed at the later end of the study, but you will need them for the sample size estimation. Study designs and the guidelines. So I told you epidemiology, observational study, experimental study designs. The guidelines are given by Equator Network. What is the nutshell we have to understand? Cross-sectional study, snapshot design, prevalence. Cohort study, prospective study, incidence. Case control study only for rare disease because we want quick results. RCT, we have to have PICOT. Apart from PICOT, I also told you that we must look at randomization, allocation, concealment, which is also equally important. Types of data, I jumped that, but I told you that you have qualitative data or a quantitative data. Yes, no answer. Male, female is a qualitative kind of answer, right? DMFS score, you'll get 1, 2, 3, 4, right? There are certain things which you have like 1.2, 1.3 height, weight, right? 5.4 kgs. So that will be with decimal points. So these are numerical values which become quantitative data, right? Qualitative versus quantitative data is something which you must understand. Null hypothesis, both the groups are equal. Alternate hypothesis, one is better than the other. So you set this principle and identify whether your research is able to support or accept the null hypothesis or you reject the null hypothesis. P-value, power of the test, confidence interval. This is what a statistician will help you with and you have to have. Statistical tests, whenever the statistician gives you, if you're interested to learn SPSS software, it's fantastic. If you say, I'm not a maths person, understand if your data is this, if your study design is this, if you have 2 groups, 3 groups, there is an equal formula which will tell you, okay, if these things are there, this will be the statistics. You only need to ask the statistician whether you use parametric test, non-parametric test, how did you infer this disease? So I think we have only created some small steps, right? They don't have to be big ones. They just have to be in the right direction. I think this orientation program is a perfect example, a perfect blend of different topics which will give you a lead in the right direction. All the very best and welcome to joining our fraternity pediatric dentistry and being a part of ISPPD also. And I once again thank all the organizers for giving me this opportunity to share some of my experience on research and biostatistics. Welcome again and thanks for the opportunity.
Thank you, Sharad sir, for that comprehensive and enlightening session. And thanks to our moderators for your seamless coordination. I now request the moderators to present the certificate to our speaker.
There are some questions in the chat box. Please do take up the questions. And thank you, Sharad sir, for joining us all the way from Cape Town.
Thank you. Thank you. Can you hear me?
I think I woke you up in the middle of the night. I'm so sorry, sir.
No problem. Thank you, man. Can you hear me?
Yes, sir. You're audible, sir.
Okay. And are the questions easy questions?
So somebody had asked, what is a cohort, sir? And that was one question. And there was also one Dr. Anushri who had raised her hand probably to ask a question. Okay.
A cohort is a group of people who share the same characteristics. So if you're studying children with ECC, they form a group of cohort. If you're studying on children with 6 to 8 years old, 9-year-old, going to the same school, following a same pattern of food or something, eating a same pattern of food, doing oral health education the same way, I think that is a cohort. A cohort just means a group of people who share or who have the same characteristic features. So when we do a cohort study, we are following that same group of people who are exposed to the same risk factors. And we are trying to find out which group of people among this cohort is actually getting a new disease, which is called the incidence. I think, is that okay, Sublakshmi?
So that should be fine, sir. I think they asked the question before you started speaking about cohort studies, okay. Most likely. And do we have Dr. Anushri here? Does she want to ask her question? So probably later, sir.
Okay.
Thank you, sir. I'll request the moderators to kindly hand over the certificate for Sharad sir.
Thank you so much.
Sir, am I audible?
Yes, sir. Yes, Anup, sir. We can hear you, sir.
Yeah, very nice presentation, sir. Great.
Yeah.
As
Thank
always.
you. Thank you. Thank you. I had to really run because Subbalakshmi had given me a specific limited time to finish the entire thing. Thank you, Subbalakshmi, and entire ISPPD head office, president, and secretary for this opportunity. Thank you.
Thank you, sir.
Thank you. Now we will present the certificates to our moderators. Thank you.
Thank you, Anup, sir, and Prasad, sir.
Thank you. Thank you, Dr.
We'll
Shu.
start with the
Thank you,
next
thank you, ma'am.
session,
Thanks
sir.
very
Thank you, sir.
Thank you,
Thank you,
sir.
sir.
Thank you,
All
sir.
the best for the remaining program.
Thank you, sir.
Thank you, sir.
Our next session brings us to a refreshing yet vital aspect of our postgraduate life, the non-scientific toolbox by Dr. Subbalakshmi ma'am. And we are honored to have with us two distinguished moderators for this session, Dr. Gunjan Yadav ma'am, Professor and Head of the Department of Pediatric and Preventive Dentistry at Sardar Patel Postgraduate Institute of Dental and Medical Sciences, Lucknow, and Executive Committee Member of ISPPD. I would also like to welcome Dr. Srinivas Nalanchakra Sir, Professor in the Department of Pediatric and Preventive Dentistry at Panmiya Institute of Dental Sciences and Research Center, Hyderabad, who is also an Executive Committee Member of ISPPD. I extend a warm welcome to both our moderators and I invite them to kindly take over and facilitate the session.
Good morning. Very good morning, everyone. My colleagues, seniors, juniors, and students. It's a wonderful program. Am I audible?
Yes, sir.
Yes, sir.
Thank you, thank you. It's a wonderful program going on. It's the first start like for the postgraduates, and probably this kind of a lectures will bring some insight and a plan for the future for the 3 years. And I'm glad that I'm a part of this program. Thank you very much. And yeah, not wasting time, I would like to introduce Dr. Subbalakshmi, Professor and Head of the Department of Pediatric and Preventive Dentistry, Malabar Dental College and Research Center, Kerala. Graduation and post-graduation is done from the Faculty of Dental Sciences, Sri Ramachandra Institute of Higher Education, Chennai. She has got a training in health profession education, University of Michigan Center for HPE, Srihar Ramanujam Teaching College, Balaji Vidyapith. And she has a clinical research methodology from Seattle Children's University of Washington in the year 2021. And to add a lot high publication, she is a reviewer for the national and international journals, section editor for the Kerala Dental Journal, and editor for the Journal of APPDK. And she has contributed a chapter for the prestigious textbook. And she is the executive committee member of ISPPD 3425. And I give it to Dr. Gunjan.
You can play the video, Pavni.
Good afternoon. Warm greetings from Malabar Dental College and Research Center, Edapal, Kerala. And welcome to the postgraduate orientation program that we have been hosting over the last 2 days. So have you really wondered why you were asked to attend this orientation? Okay. So then I thought, okay, the moment we say orientation, what does this word mean? So Orient actually means it's the countries of the East. So are we orienting you because we are somewhere in the East? It's actually a special luster. No, it's a pearl of a fine luster. So I said, is it because, basically that all of you are pearls who are going to be in pedo? Or when we look at the verb, it says it is to align or position oneself in relation to unfamiliar surroundings. Or it is to guide someone in a specified direction or tailor or adapt something to specified circumstances. So probably this is what fits in for our idea of this whole program.
Chachu, chill, Bruno.
काफी ट्रेंड हो गया है।
मैंने किया है, कमाल का कुत्ता है।
अच्छा, ब्रूनो,
कमाल का कुत्ता।
पानी ला। टिश्यू ला। ब्रूनो, फैन ऑन करके आ। जा करके आ। कमाल का कुत्ता है।
कुत्ता है, गधा नहीं। गधा।
The next generation is smarter, presenting the next generation fans.
So yes, we do realize that though we are here to orient you, you're much smarter than us and definitely all set out and planned out to have a wonderful 3 years of learning. Welcome to Team Pediatric and Preventive Dentistry. So today I'm going to be talking about the non-scientific toolbox that you should be building as a postgraduate. Some skills which are beyond science, which will make your journey more meaningful. Because understand that the postgraduate life is definitely much more than your syllabus. And what you learn outside the textbook will define how your career will be inside your clinics. Right? So what are the things that you really need, which is going to shape success? Is your attitude, the way you're able to adapt to yourself, your communication skills, and how ethical you are. So over the next 30 minutes, let's talk about communication skills, digital literacy and harnessing AI, how to manage time, and about team dynamics. As I begin, let me also say a small disclaimer that what I'm sharing with you are more from my experience and little tidbits from them and my learning from that. Please do follow the norms and the regulations of the department of your own departments and do listen to your faculty and peers around you. So communication skills, that is one of the biggest skills that anybody needs in today's world. Forget being a postgraduate and needing it, anybody requires these skills. Basically, it is your ability to convey a message or information accurately, especially with no miscommunication happening. So what are the different types of communication skills that you will have to develop? You will have to develop skills for verbal communication, non-verbal communication, written communication, and visual communication, of which I will not be talking much about the visual communication because I think it was so beautifully done yesterday during your presentation on seminars and journal clubs. But what is the most important of these communication skills? The most important of the communication skills is your listening skills. Because as a human being, as a postgraduate, as a person who's treating children, as a person who's going to be seeing people with so many different ages during the day, with different temperaments, with different backgrounds, you will have to learn to engage with them by hearing and understanding their message to ensure full comprehension, because you really have to understand what they're trying to tell you. And how do you engage as a listener? You have to give them non-verbal cues. Nod your head, smile, reflectively give them feedback to make them feel that you have understood what they're saying. Avoid interrupting people when they're talking. And ask questions if, to show them that you're actively engaged. Oh, is it? Oh, small things like that, those could make a huge difference in the way you communicate with someone. The next is speaking, the way by which we express our thoughts, ideas, and instructions. So, you have to make sure that you articulate them very, very clearly. Use an appropriate volume according to the person to whom you're talking, according to the situation in which you're speaking. Based on all these things, adjust your tone, adjust your volume, and have your thoughts organized. See, you may be answering in a viva. So when you're going to be answering, take a moment, organize your thoughts and answer the question. And adapt yourselves to the audience to whom you're talking. Because we will have to engage in a little bit of baby talk when we're going to be talking to children, right? Or, the way we talk is going to change. So be ready to do these things. Make sure that you develop these skills to change the way you talk, right? Then we move on to nonverbal communication. Here, what are we doing? It's our body language, facial expressions, which we use to interpret and convey messages, right? It is, I didn't like what you're saying. You don't even have to say a word, right? I know when you walk into your professor's room or your guide's room, she or he wants to convey to you that they're not, happy with what you've done. It doesn't take them many words most of the time. So, but similarly, even you can develop, and it's not only can, you have to develop these things. And remember, your expressions, your language should be incongruent with your verbal message that you're giving. Because at a lot of times we know that, the message can get completely misinterpreted with the expression that you give. If you just smile and deliver something, somebody is not going to take you seriously if that is something that has to be taken seriously. So be very careful about how you keep your nonverbal communications. Effectively conveying messages in written form across various platforms is also equally essential, for which you need a clear language, correct grammar, for which we have AI, about which we will discuss in a little bit. But definitely, you will have to develop consistent writing skills too. Okay, so now we have looked at how to speak, how to listen, how to write, how to, non-verbally communicate. Then let's look at what are the different communication styles. Very basically, we can look at communication styles in 4 different ways. Somebody who's a passive communication, an aggressive communication, assertive communication, and passive aggressive communication. All of us will have to adapt to each of these different styles at certain points of time. But it is one of the best ways of communication is by being an assertive communicator, where you're very clear about what you want to express. You can make sure that you keep within your own rights, but be respectful to the others and try to genuinely want to connect with people with whom you are communicating. Now I shall go ahead and give you a little bit of tips to effective communication. This is what happens at a lot of times. There is, this is what I wanted to say, this is how he said, but this is what he heard, and this is what came back, right? And in between, there's a lot of noise. So that is not going to help us. So what should we do? When it comes to communication, remember these C's. Keep your message very clear. Keep it concise. Let's not keep, beating around the bush for a long time. Keep it concrete. When I say keep it concrete, make sure that what you're saying makes sense for that situation. Keep it coherent and keep it complete and courteous. All these C's really help in avoiding all the noise that we were talking about in the previous slide. And when it comes to written communication, especially when you're writing emails, you can follow up this acronym of keeping them brief, which is basically you give a background of who are you, what am I writing to you about? That is your next part, which is your reason, and then give the information that you want, end your communication, and follow up. So make sure that when you write emails or when you're doing a written communication, you do it this way. When you're communicating with faculty and patients, remember two things. Be truthful. Respect. Because respect is something, if you want your patient to respect you, if you want your faculty to feel that, you want them to respect you, then it is a give and take thing. So, communicate keeping in mind some respect. And that has to be truthful too, right? Another important thing or point about communication is emotional intelligence. I know all of you are, belong to the generation, the latest millennials or furthermore. So you all understand what it is, what is emotional intelligence or your EQ, emotional quotient, is what is most important, is as important as your IQ. So it's basically how we can manage our own emotions and recognize these emotions in somebody else and communicate empathetically. That is, we can think of ourselves in the situation in which that they are there and act or communicate accordingly. Right? So how do we do this? We will have to recognize our own emotional triggers. This will take us, you will have to be self-aware. You will have to know that what triggers you. So, and you will have to and then start planning to do self-regulation, right? And you will have to regulate yourself. And one important thing you should remember here is to respond and not react, especially when you're under stress. And when I say respond and not to react, it means don't say the first thing which comes to your mind. Don't do the first thing which comes to your mind. Take about 15 seconds to 30 seconds. Think about it. Look at it from the perspective of the person who has communicated with you. Look at it from different perspectives and then respond to the situation. This will go a long way in building a lot of relationships around you, right? And the final thing about communication is that the way we communicate with others and with our own self ultimately determines the quality of our lives. And the way we communicate today is, yes, we'll, click the like button and we'll keep going. So that's the next topic that I'm going to be talking about. The next skill that you will have to develop as a postgraduate is digital literacy and harnessing artificial intelligence. Oh, whom am I talking to about digital literacy? You were all digital natives. You were born with the mobile phones, right? Unlike many of us, who had to live through different eras before we got to see a phone. Yes. What all can you use artificial intelligence for? You can use them for your academic learning. You can use them for clinical decision supports. You can use them for communicating and for research and publication. So we look at each one of them. For academic learning, see, there are a lot of things. It's not going to be possible in the next 3 years for you to learn everything about your specialty by just being in your department. You cannot learn everything by just doing seminars or journal clubs or learning from your guides. So there's definitely going to be reasons when you will have to be learning beyond the walls of your department or beyond the walls of traditional learning platforms. That's when we look at adaptive learning platforms like Coursera AI, which is going to help you to gain a lot of additional skills that you will require. Even those academic skills that are mandatorily part of it, these really help you. Of course, all of us know about, the virtual simulations, and there are opportunities where it is available. Another very useful AI chatbot are the chatbots which you can use for Viva and exam preparations, because they will help you make flashcards, they'll help you make Viva cards, they'll ask you questions, they'll evaluate your learning and even tell you how good you are or where you stand at this point of time, right? So for academic learning, AI does play an important role. Again, in clinical decisions and clinical support, yes, you can use AI for radiograph interpretation, for predictive analysis, for KDs, behavioral risk. There are a lot of these which are available now, as especially for predicting behavior, for predicting, what is more comfortable for your patient, what you can do. All these things, definitely AI is there in a big way, and you can harness it, or rather, you should be able to harness it. Research and publication, literatures, and when it comes to research, AI is the big thing now. So definitely, right from when you're going to make your protocol, when you want to write, refine, and frame your question, you have all your synthesis tools, literature search tools, like your Elicit, like your Research Rabbit, which gives you wonderful maps of it takes you to helps you look at your research question in a completely different light. So definitely important. Again, when you're going to do data analysis, visualization, or even when you're writing your references, all these, there are so many AI tools which can help you make your work simpler. And writing and language tools, yes, Grammarly. There are a lot more of tools like this, Perplexity, a lot more of these tools which can really help you to write your research findings, or even your protocols to be developed much simpler way, right? We can also use AI in patient communication. We can use voice-based translators for multilingual counseling. Very important upcoming area which for us as pediatric dentists is AI-driven behavioral analysis. And when I say behavioral analysis, it is not about behavior management. I'm talking about how parents brushing, or follow-up of oral hygiene at home. All these things, there's a huge way in which AI is helping us and which you could use them. More about harnessing artificial intelligence to enhance learning in pediatric dentistry. You're welcome to attend my session on 21st November at 4:30 to 5 p.m. at Pido Dham at Bhubaneswar. So in this, today during this orientation, this is all I have time for to focus on AI. We will talk more about it then. So remember, important thing is to build the professional reputation for yourself in the digital world. That's very, very important. All of you, I'm sure, have FB and Insta. I know FB is outdated, probably Insta, or I don't know what else is the next. So accounts, make sure that you have a LinkedIn profile and a ResearchGate profile too. Keep building these IDs. They are, it's okay. We all started small. So, start building your ID right from your postgraduate time. These ones will really help you make a reputation in the digital world. So being digital professionally, maintain a consistent name, right? Photograph and affiliation across all these platforms, right? And in these platforms, avoid informal or controversial topics. Okay, not only here, even in your Insta or on your FB, you can be careful, but at least in these platforms, please be very, very careful. And, I don't know how many of you have noticed this slide I've called being professional digitally and not being digitally professional. Okay. So what I mean here is keep your content very authentic. And what matters is the quality of your content much more than the quantity of your content. It's not about 100 publications. It's not about that you have to go every day and make a post, right? What is more important is how, what quality communications you make there, what kind of profile you project, right? Definitely, you make a presentation in a conference, you attend a webinar, you have done something, you know, some volunteering. Please make sure that you put it in your digital profile also, right? So, and use AI tools ethically, and for, you know, wherever you're using them, just remember that AI is your smart assistant. So make sure that you use it ethically and with a lot of responsibility. It is really smart and it will really help you in a long way, but don't let it control you. Don't let AI make or define you. That's very, very important. Now we will move on to the next part of your skill building. That's building teams and managing time. Because both these things are again going to be two skills which are very, very important for you as a postgraduate, right? So who's a team? It's a group of people who work together towards a common goal, right? And each one of us contribute in our own ways to it, right? So a postgraduate journey is never a solitary sprint. It's not going to be over by you alone, and you're not going to be able, it's not going to finish in a short while too. So it is about shared learning, mutual support, and collective growth with a lot of people. It is with your peers in the department, your seniors, your juniors, your faculty members, each one of your patients, your chair side assistant, your technical team at college, your librarians, so many other people. So being a part of the team is very, very important. And remember one thing, your teamwork, it extends much beyond clinical settings, and that it will really enrich the way your post-graduation goes, right? Because you need them to navigate the highs and lows of life. Post-graduation is not easy, it's quite stressful. So you need your friends, you need your juniors to be with you, when you need the support. And when you're going to be having your exams, when you're going to be doing research, when ma'am seems to be asking you so many questions, you don't have the answer. So whom are you going to ask, right? So team building is very, very essential. And remember that it is essential for you. So you have to be a team player. So what are the essentials of forming or the foundations of forming a good team? First is trust. Believe in your colleagues' capabilities and intentions. Believe that your faculty, believe that your friend is going to help you, that they have capabilities and they are truly there to help you out. Definitely make your communication, keeping your communication open, honest, and timely dialogue is crucial. Because a lot of times, relationships and teams start faltering out when dialogue doesn't happen. Sometimes we think that, oh, maybe I shouldn't say this now. And when we keep that silence for a long time, teams start, slowly things start eroding into the team. So be careful about it. Be empathetic, understand and share their feelings. Okay, they had a bad day today at the seminar. So, it's okay, understandable. So don't go, they behaved a little harshly with you. It's okay, understand it, right? And be accountable, take responsibility for your actions and commitments. That's equally important. You didn't do something today, tell, ma'am, I'm sorry I was not able to complete this because of this thing. So take responsibility for your actions and make sure that you try to keep up with your commitments as much as possible. And what happens? What are some of the small things which go wrong or where there are some challenges is when you have an unhealthy competition. You can compete with each other, you can try to grow together, but at the same time, do not take it to a level of unhealthiness. There can be times when, instructions are not very clear, or when we assume things, right? We just think that, oh, this is what they would have meant. I thought you said this. So those things, avoid. and understand that usually our biggest challenge that we face is burnout and stress, where a lot of us is really stressed out and we take it out on the team, or we think that it is better to work without a team. So definitely polish your team building skills, have open dialogue, be a good listener, and prioritize well-being, right? When we do these things, develop your support systems. That's equally important, whether it's family, friends, colleagues, faculty. Develop your support system and build teams everywhere. It's very, very important. At this point, it's with a lot of pleasure that I'm sharing, my team from my postgraduate days, my seniors, my juniors, a couple of pictures with my faculty also, and many opportunities and things that we have shared. And very proud and happy to say that the same team today has these remarkable answers to us. We have these wonderful research papers which have come out from that very team. And, it's not done during post-graduation. Even today, that team is a wonderful place for, me to be part of. So remember that your team today is going to be your team for life. The last part of this presentation is on managing time. We all know that you have exactly 3 years and a set list of tasks to complete. So if you can organize and plan how to divide your time between these activities, then you can definitely get your work done much more smarter. So what are some of the ways by which you can do it? Number one, set your goals. I'm very sure the curriculum has given you a lot of goals, which are basically long-term and goals which are there. Make short-term and long-term goals. When I say short-term goals, make a goal for a day. Make sure that you have a goal for a week, and you have something for the month, and one for the end of the next 6 months or at the end of the year, right? Make sure that you have these goals in mind. You are aware of them. Write them down. Not that you sit down and make a list of goals. What I say is, as and when you make your goals, please write them down and take time to go through them once in a while. The 1 minute goal was a mantra which was actually practiced at Srihar. So what was being done was, there is a written goal of how you want to do the task that you're setting up to do. So it is written down and you read that before you do it. So before you start presenting your seminar, you read about, okay, how do I want to present the seminar today? How do I want it to be, and what do I plan to achieve by it? So this really helps to clarify things a lot, right? So make sure that you set your goals wisely. Again, next important thing is prioritize. So make sure that, especially based on your short-term goals and your schedules, start prioritizing things, right? You have seen this Eisenhower decision matrix yesterday during Dr. Seema's presentation. So it is the same matrix that I would say, always use this to prioritize. If it is something important and urgent, do it immediately. Something which is not urgent, but which is definitely important, which is your long-term goal, make sure that you have to do it and schedule a time for doing it. If it is something which is urgent but not important, make sure that, if you can delegate it to somebody else, or if, you are that somebody else who has been delegated to do it, get it done. Then it is important and urgent for you, right? And if it is not urgent, not important, eliminate the task. This would really help you. Make sure that you have an activity calendar and share it with your co-PGs and keep updating it. This is part of both team building and making good use of your time. So definitely make sure that you have a weekly schedule. So this is something that we follow in our department. Please follow whatever is in your department, which has, all your tasks which you've completed the past week. What is the work you've planned for the upcoming week? And from your plan for the last week, what else is pending? So keep doing these sincerely. That will help you to prioritize a lot of tasks for you. It'll really help you out. And one person or one skill that you don't want to build Is procrastination, basically that's postponing or delaying tasks, that you keep doing it, right? So very surprisingly, one of the biggest reasons why people procrastinate is because they are perfectionists, because they want it to be perfect. So how can you avoid this? Beware of your internal dialogue. So evaluate how much time is there, what am I doing, how much time can I take for this task. Make sure that you do it that way. And if you see that you are, you have these traits, make sure that you plan less and take action rapidly. Plan to do less and get it done. It will really help you. Focus on the benefits and think that, okay, if I get this done, what else can happen next? So look at those things also. It'll really help you to overcome procrastination. One small technique for you to make good use of your time is your Pomodoro technique. So you have a task which you have to do. It is quite a long task. You have a seminar coming up, and you just are not able to sit down and prepare for it. And you've been going on, it's been on your pending list for a long time. So what can you do? Set out a task. Say that I will read this 4 chapters today. Start reading the first chapter, take about 15 to 20 minutes for it. That's one Pomodoro. So once you complete that 15 minutes or 20 minutes, take a 5-minute break. Once you've taken that 5-minute break, don't take longer than that. Come back and do the next chapter. Then again take a 5-minute break after 20 minutes. Come back. And once you've done about 4 or 5 Pomodoros, take a long break for half an hour. And at each point of this time, keep recording what you've done. Because it's really nice for us to see that, smaller tasks are getting done. So it's easier for us to go ahead and complete our tasks. So managing your time is equally important. So know where you're running to, what are your goals, set short-term goals, look at what you can do, with your tasks, set your priorities right, and take control. Because remember, we are not given a good life or a bad life. We are given a life. It is up to us to make it good or bad. I wish that all of you enjoy every bit of your postgraduate journey. As always, I'd like to end by saying, let us not stop at shaping smiles. Let us shape some lives too in whatever ways that we can. Thank you.
Great presentation, Dr. Subbalakshmi. Can you hear me?
Thank you, ma'am.
Thank you, ma'am.
I don't think we have any questions. I just saw one Dr. Disha Manier has raised her hand. Do you have a question, doctor? I guess not. Oh, there.
Dr. Subbalakshmi?
Sir?
Yeah, it was a wonderful presentation, like giving a brief about them, like what to do, what not to do, like what to plan for the 3 years, how to avoid problems, and the most important, communication skills. Like most of them nowadays lack that. And non-verbal, to specifically say that, like you are very clear, most of the students might have heard about it, hear about it, might think about to change themselves to want to be a positive side. It's a wonderful presentation. It's
Thank you,
nice.
sir. Thank you, sir. Thank you, sir.
Telling the tips about team building was also very nice. Like people generally don't do it in PGs, but yes, you have given them the idea how to go about it. That's wonderful.
Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am. Presentation. Thanking team ISPPD,
Thank you so
Sashikaran
much.
sir and Goyal sir and Subbalakshmi for a wonderful initiative for this and making us a part of it. Thank you so much.
Thank you, ma'am. Thank you.
Thank you, ma'am. Thank you.
Thank you so much, ma'am, for the insightful and inspiring presentation, and a word of appreciation to our moderators for your valuable contributions. I now request the moderators to present the certificate to the speaker.
Yes.
Thank you.
Can we have the certificate, please?
Thank you, ma'am. We'll
Thank
now
you so
present
much.
the certificate to our moderators.
Thank you. Thank you,
Thank you.
ISPPD. Thank you, guys. Thank you, Dr. Subbalakshmi.
Thank you, sir, and thank you, ma'am.
Thank you so much.
Thank you. The next section focuses on one of the most crucial decisions every postgraduate must make, choosing the dissertation topic. And the speaker for the session is Dr. Arun M. Xavier, sir. I now invite our respected moderators, Dr. A.J. Sai Shankar, sir, Professor and Head, Department of Pediatric and Preventive Dentistry, Sibar Institute of Dental Sciences, Guntur, and Executive Committee Member of ISPPD, along with Dr. Suprabha ma'am, Professor in the Department of Pediatric and Preventive Dentistry, Manipal, to lead Mangalore Manipal to lead the session with their invaluable insights and guidance. Over to you, sir and ma'am.
Yeah, good morning, everyone. It's a good initiative taken by ISPPD and under the leadership of Dr. Subbalakshmi. It's my privilege to introduce the speaker of today's presentation, Dr. Arun, who is a good friend of mine. He has completed his undergraduation and post-graduation from A.B. Shetty Dental College, Mangalore, and he has been awarded Best Outgoing Postgraduate Student in the year 2010. And presently, he is working as Professor, Department of Pediatric Dentistry, Amrita College, School of Dentistry, Cochin, Kerala. And being a good orator, he has various papers on national and international platforms in various countries like US, UK, Japan, China, and obviously in India. And he has a big list of awards to his credit. And best among them is the Best Bright Smile, Bright Futures Award in Glasgow in 2015. Young Periodontist Award by ISPPD in the year 2017. Young Research Award in 2018 by International Award of Excellence, London, UK. Outstanding Researcher in Pediatric Dentistry Award in 2018. Academician of the Year 2018. Specialist Dentist of the Year 2018 from FAMDent. And the list goes on. And finally, he has a good number of 30 scientific publications in national and international peer-reviewed journals. A good academician, good orator, and ever-smiling Arun Xavier for us. Thank you.
Thank you. Thank you, sir. Thank you.
Pavni, we can play the recording, Pavni.
A very good morning, one and all. At the outset, I thank the organizers, the ISPPD and the Department of Pediatric and Preventive Dentistry of Malabar Dental College for giving me this opportunity to be a part of the first National Periodontic Postgraduate Orientation Program. Without much of a delay, may I invite you all to my presentation titled, Choosing the Dissertation Topic. I'm sure many of you by now would have come across the term dissertation. It is a long, formal academic document that presents either original research or an existing research on a topic and is typically required for a master's or a doctoral degree. Dissertation in an MDS curriculum could be either a thesis document or a library dissertation. In my presentation today, in the first half, I would be talking on the thesis document, and the second half would be on the library dissertation. So what is the thesis? It is nothing but a document that is submitted in support of a candidate's academic degree or his qualification, and it presents his research and findings. So what is its purpose? It enables the student to develop a deeper knowledge and understanding and enhances his capabilities and attitude in research-based activities. It is definitely a mandatory postgraduate requirement. So I'm sure many of you by now must be in a situation on what exactly should I choose for my research topic. Either you might be having a lot many ideas, or you may be too lazy to pick any one that you have. So let me just walk you through different ways of how exactly can we select a research topic. First and foremost is your interest. It could be your interest, your guide's interest, or your institution's interest. The second is previous knowledge on the subject. Suppose you are focused on a particular field and you have done some research on a particular area previously, that could definitely help you to build further. The third is the topic that you are selecting should be relevant not only to your study period, but also for your career. Number four, whatever topic that you choose should be good enough to have a lot more supporting literature, because that actually builds up to your research. Number five is scope and requirements. It should be within the scope of your subject, your the clinical background, as well as the future and the consumer. And last but never the least, it should be approved by your guide or professor. So in short, I would go by the technique, the consumer innovation adoption technique, where consumer stands nothing but for it should be beneficial to the consumer. Whatever topic that you choose, whatever research that you choose should be easily available and should be easily used by the public. Innovation stands for something new. Whatever you do a research for should be something that is never discovered. And lastly, it should be something that benefits the public at large, and that's adoption. So the most easiest way to choose a research topic is going through the discussion section of an article. It is in this section of an article or a manuscript that you read in different journals where they discuss what is the area that requires more amount of research. It gives you exactly on what are the gaps that are available in research in this particular field, and that's where you build up your topic from. So these are different platforms from where you can get articles in hand. The first and the easiest way is a visit to your dental or medical library, where your librarian is definitely going to help you out with probably some links where you can actually easily download them. The next is enrolling yourself in ResearchGate. And that's the best platform where you get in touch with millions and millions of researchers across the globe, where you can actually, send an email or personally request for the article if it is not easily downloadable from any of the sources that you have. The next option is going through the National Dental Library website, where you get a collection of articles that are available. The next option would be browsing through other search engines that are used in scientific research, which I have mentioned here from PubMed, Google Scholar, Science Direct, Scopus, and so on. So these are the options that are easily available in front of you. And in case, with all the attempts that you make and you're not able to gain your article in hand, the best option would be emailing the corresponding author of the required article, and probably he will be able to help you out with it easily. And if still nothing works, get again back to your college librarian, who can probably give you some other source of, a source of or method by which you can gain your article. So whenever you choose a research topic, it is always essential to identify whether the topic is relevant or not. And the best way to find out whether it is so is by answering these 5 questions. How are you going to do this research? Who is going to be benefited by it? What are the steps that you're going to undertake for this process? Where exactly is the study location going to be? And why exactly are you doing it? Is it going to be beneficial to somebody in the society? If all these 5 questions are answerable, I'm sure whatever research you do can be easily published. So this is a stepwise fashion by which how you can narrow down to a topic. Now, I have till now discussed on what are the various ways by which you can collect as many articles, how you can narrow down from, the whole lot of information that you have with you is what I have discussed now. Now, coming and narrowing down from there till this is through the stepwise format. So once you have selected a subject area, I would suggest that you go in good and have a deeper insight into that particular topic. From there, you need to narrow it down because you just have a 2-year period to do your research. So you need to narrow down the topics so that it can be completed with a maximum period of like 2 years. That's like just the maximum. And from here, you can arrive to a preliminary hypothesis and then finally develop your final research question so that you can finalize the topic. So I give you this stepwise measure as an example. Now for me, I wanted to choose something on dental erosion. So what I did is I read 3 or 4 dentistry textbooks to get a basic idea on what exactly it is. From there, I went into deeper aspects of dental erosion. I studied what is the different enamel hardness in primary and secondary enamel. I studied the etiology of dental erosion. I studied more on dental hypersensitivity, preventive factors, etc., related all to dental erosion. I had browsed through textbooks, journals, several forms of the clippings, newspaper clippings, etc., and got some idea on how exactly is dental erosion caused and probably what are the different measures that we can advocate to prevent dental erosion. So now I thought I need to narrow this down. So I decided to focus more on enamel erosion and how do you protect the tooth from getting eroded. So from here, I started doing a detailed search from the whole bibliographic check that I have just discussed in my previous slides. I went through the college library and other sources. I went and narrowed down to this particular field. Now, next, I wanted to narrow it down still further. So what I decided is to compare whether protective factors can be different with a primary enamel or a permanent enamel. And that's how I went to step 4. And finally, I came to the final research question or hypothesis where I wanted to study on the surface microhardness changes of permanent and primary enamel in beverages which are modified with protective minerals. So this is how, from the basic concept of dental erosion, I developed a topic to the end. So this should be the strategy that each one of you follow so that you can narrow down your topic easily. So once you have narrowed down this topic, it's yet not time for you to finalize this. You need to do a pilot study. What is a pilot study? It is a study which is done on very minimal samples so as to know whether your study is feasible or not. So probably you take less than 5 samples, samples for your study and try and work it out whether whatever methodology that you're going to follow is going to be successful or not. You will know what are the deficiencies in your work when you do a pilot study. And from here, you can modify your research topic based on a pilot study. So once you are successful with the pilot study, I would say it will be now a time you have reached where you can actually go and make your study protocol. So from here, you build up on your introduction, You build upon the methods that you're going to follow for this. You can prepare dummy tables on what exactly are we going to do your research on, and what exactly are the pre-values, the post-values that you're going to think about. All these rough tables and all that, you can start from the pilot study. So once your pilot study has been successful and you have now decided to focus on this particular research topic, then next would be deciding on what exactly should be the sample size for your research. And the best person who could help you with this is your institutional statistician. So once you go with the key article of your research on what exactly you're going to focus, the research statistician is going to have a face-to-face conversation with you on several aspects of the study. They usually would consider whether the population is variable, what is the kind of population size that you would require, what is the confidence level and margin of error of the study that you're going to choose, what are the research constraints like the time, the budget, and all the logistics, and finally they would help you with the research design and statistical analysis. So once your sample size has been derived, it is now time for you to narrow down to a synopsis. A synopsis is a document that you prepare where the whole protocol is prepared in the institutionalized manner so that it goes in for the research committee or the ethical committee. It usually follows a general outline, like it will have a title, the introduction, review of literature, aims and objectives, methodology, sample size derivation, expected outcomes, timeline, statistical tests, analysis, and references. And finally is the endorsement of yourself, your guide, co-guides, and the research head. So once this is all done and you have got all the approvals, it's now time for you to submit it to the institutional review committee. So here you have to present your protocol on what exactly you're going to do. You will get a lot of comments from the SRC committee, and from here on you can modify or probably, a lot more changes can be done at this stage. And once the corrections, everything is amended and all that is over, we move on to the next stage, which is the institutional ethical clearance. So once it is approved, you are formally now in line on whether you can start your study or not. So all the decision is made with the ethical committee. So now when exactly is the ideal time to start and end your thesis? So I would say the best time to start your thesis is as soon as you complete your preclinical work. Some institutions say as soon as the library dissertation is complete, you can start. While some institutions, they focus on second year of your post-graduation to begin your thesis, but mandatorily there is no particular time when exactly you need to start. Earlier is always the better, because you know that at the end of the year of your 3-year curriculum, towards the end, you need a lot of time for your self-study and research, or research for your preparation for exams. So it would be always best to start your thesis as soon as it's possible. And by the first 2 months of your final year would be the brim of when exactly you need to stop your study so that you can start with the write-up. Write-up can always begin in between as well, but you need to complete your thesis document, write the research work by the first 2 months of the final year. So this is how the thesis write-up structure would be. So it begins with the bona fide certificate, the ethical committee approval letter, the acknowledgement that you have for all the people who have contributed, the abbreviations of the study, the figures, photographs, list of tables, graphs, and introduction, aims, objectives, materials, methods, results, discussion, summary, conclusion, and references. So why I have put up this slide is, you see number 5 as list of figures and photographs. Whatever procedure that you're doing in this thesis period, that is during your thesis research, it is mandatory that you keep all the photographs, the official photographs of your equipments, of how you're doing the procedure, and all that documented, so that it's going to be beneficial when you make up with the thesis document. So this is the whole lot of things that you need to accumulate in a thesis document. I know it's very tedious, but at the end of the day, always remember, this is like one part of your PG curriculum is your thesis. And once that is done, always remember that you're very closer to your goal of achieving the MDS degree. So there are different formats as per university. Some say that you need to also add a structured abstract in your thesis document, which would again have a small subsection. I can tell you what exactly comes in an abstract in the following slides, and the list of things that I have told you in the previous slide. So this is about the abstract. The abstract is nothing but a nutshell of the whole thesis that you have done. Keep it as less as 500 words. You need to structure it based on the titles like background, methods, results, and conclusion. It should be clearly written, it should be well understandable, it should be accurate, and it should be specific. The next section is the introduction, where you exactly explain what exactly has reached you to this topic. Describe the kind of approach that you're going to use in the study in a very introductory style. It should be as brief as possible, and at the same time, you need to mention the limitations of the previous research and conclude your introduction with the aim of your study. The next section is methods and the methodology that you're going to follow. So here is where you're discussing on your writing, your titling, the titles, the subtitles would be on where exactly you're doing the study, what are the methods that you have adopted, what are the armamentarium that you're going to use. All that is discussed in the methods section. So you need to describe previously whatever procedures that you're going to use for this particular study. You need to cite them as well. So identify the equipments and the materials that are used, and as well as you need to use proper notations, including chemical formulas and symbols, exactly in this section. So that you should not make new short forms for chemical agents, etc. If you are using in your study, you should not be changing them and introducing something new. You mention the exact and the proper notations. The results, all data which are there that you have collected as primary and secondary objectives should be all stated here. It would be always good to structure your results based on different objectives as subheadings. You need to mention, you need to use as many figures as possible and tables for more clarity and efficiency. And of course, you need to discuss on the statistical input that has been given from your statistician. So it should be the graphs, the figures, the tables, all should be self-explanatory as I have shown here. So from one end you can see, you interpret it in this way, and the same way you interpret in another statement on the other end. So the whole results section should be self-explanatory and very clear. Discussion, which is the most important section of a thesis document, is where you interpret your results. And here you can actually relate to what exactly, where the favorable points for your for the study as research done previously, as well as those which contradicted the findings of your study, can all be critically appraised in the discussion section. So you need to also, at the end of a discussion section, you always need to actually list what are the limitations. What are the limitations of your study? What are the plus points of your study? What exactly is the future scope of your study? What is the lacunae of your study? All that be very open and discuss here. So this is actually a pathway for a researcher to do his next research, based on what you have done. So this is just the area where you can actually build up and take your time and build it up, and avoid making statements which are baseless and not having any scientific background. Do not make any kind of statements in the discussion section. The conclusion section definitely would be a brief overview of what are the results that you have obtained, and make sure that the abstract and the conclusion should not be exactly the same. Acknowledgements, you need to acknowledge all those people from the beginning who have helped you through. The advisors, the financial supporters, the proofreaders, and the suppliers who have donated materials of any. Now, there is a different format as per university across the country. So you need to follow the particular style that is followed, and the declaration forms, etc., the copyright forms. And of course, I need to mention some universities are very particular of a plagiarism report. So a plagiarism report is required. Basically, what exactly is plagiarism? Plagiarism is nothing but appropriation of another person's idea, process, results, or words without giving any credit to them. So basically, you should not be doing, you should keep plagiarism as minimal as possible, and acknowledge all those people from where, or cite from where exactly you have taken any sentence, phrase, a definition, or whatsoever that you have taken. You need to incorporate the citation of all these external sources in your thesis. So plagiarism can be easily detected with several tools. Several tool engines are available. Cross-check, Turnitin, and a lot more engines are available. So these are the areas where actually they can actually find out whether or the percentage of copying that has been done. They say that you can use ideas, phrases, and arguments from sources that are already published, but you just need to acknowledge the source or the original author. So that's very important so as to avoid plagiarism. And last, a thesis document always ends with some annexures. It includes the consent forms in different languages. If you have used questionnaires in your study, please incorporate the entire questionnaire. Include the clinical record forms, that if you have used any, if you have used any scales to measure anything in the study, please incorporate the figures and the explanation, the interpretation of them. And you should also include, if you have received any financial support, you need to incorporate that as well. So once you're done with your entire thesis, you might think that the whole work is done, but always remember, it goes to an external person. Usually it goes to the examiners, usually it goes like that, but otherwise it goes to an external examiner who evaluates your entire thesis, and probably it's from here he might find faults and request you to do modifications. So try not to fall into such trouble. Make sure that before your thesis is bound, you need to have a complete evaluation of what exactly you have written, and make sure that there are very less or very minimal mistakes so that you don't get easily caught. So that moment when you finish your 40-page thesis, it's always essential that you read it once or twice again, just to rule out that there are no mistakes left and you don't get caught at the last minute. So once everything is done, yes, happiness is completing your thesis, and a major chunk of your postgraduate curriculum is complete by the time thesis is done. So congratulations on completing the thesis at this point. So now I move on to the next part on what exactly is a library dissertation. It's more or less the same as thesis, but here the major difference is, in thesis, it was a research that is done by you. The ongoing research is what is discussed in thesis, but in library dissertation, it's a collection of matter where previously done research by someone else has been discussed here. So that's a nutshell of what exactly it is. It is basically a scholarly work that critically analyzes and synthesizes existing research on a topic rather than collecting some new primary data. So basically, it may involve comprehensive literature review to answer some research questions. It identifies some gap of knowledge and also helps in future research. And it also gives an insight on what is the kind of work that has been done by the others. So where exactly should I begin from? So this, I have given you 3 important things that you need to keep in mind while you select a library dissertation topic. Number 1, it should be relevant. It should be relevant to the subject that you're doing. It should be relevant to the field that you're working in, so that it is easily accepted by your professors, by the institution. And once you go back and join into work, it becomes of major help to you. Number two, it should be of interest to you. Not only to you, your guide's interest as well, which is important, because both of you spend a lot time together, sitting, you preparing and you correcting your documents. So it is essential that it should be of the interest to you and your guide. And number three, the data availability. You might have a lot of data, or you might have minuscule of data. So it is essential that you should be in the mid of both of them. If there is too much of data on a particular topic, it is definitely very difficult to make a concise version of it. And if you have a minuscule of data, it is very difficult to actually build up and make a library dissertation which is of standard of your university. So try and select topics of interest which is not having a lot amount of literature. Narrow it down in such a way that anyone can easily comprehend, and probably you can also develop a research article or a systematic review or a meta-analysis from a topic based on your library dissertation. So these are the three main things that you need to keep in mind when you choose a library dissertation topic. So this also has different sections like the title, acknowledgement, table of contents, abstract. It includes introduction, the main chapters of your library dissertation, followed by the end is a discussion, summary, conclusion, and references. So that completes the entire library dissertation, which is nothing but a compilation of data that already exists in your libraries, in the databases that are available in the internet, etc. So you need to compile it in a different format. You should not be copying somebody else's library dissertation, but rather make something new so that you can actually get them published as well. So these are different ways of how you can draft an effective library dissertation. So these are all different search engines which help you in actually framing sentences, modifying it. There are paid sources, etc. So grammar at the end, definitely we are all not so good with language, maybe not all, but many of us. So probably tools like this, which are also available online, can definitely help you with the grammar check and making your document look as authentic and as good as you would prefer it to be. So suffering is always temporary, but always remember that the victory is yours. You completing your library dissertation, you completing your thesis dissertation on time is definitely going to be your victory. The earlier you finish, always it will end up in you getting more time in spending more with your subject per se, preparing yourself for your written exams, etc. So I wish you all the best, and I hope you have a successful MDS tenure in your academic curriculum so that you can finish all of them on time. So once again, I thank the organizers for the opportunity, and I hope my presentation would be of benefit to the upcoming postgraduate students. Thank you for your kind attention.
I thank the organizers for the opportunity. I thank ISPPD. I thank Malabar Dental College. I thank the General Secretary, the President, and all the ISPPD members, my dear moderators of the day, the conveners of the program for the excellent execution. I thank each one of you for your kind attention as well. Thank you so much.
Thank you, Dr. Arun, for that excellent presentation on choosing the dissertation topic. You have given a nice overview, breaking it into simple steps, how to go about choosing the topic. Not only that, you have covered even how to go about conducting the study, doing the write-up, and also a bit about the library dissertation, the steps as well. And also differentiating between the two, which I think is very, very important. So you have done an excellent job, and I'm sure the postgraduates who are listening to this will benefit and help them navigate through this journey, which is an important step in their curriculum. So thank you so much, Dr. Arun, for doing this job. Yeah, thank you.
Thank you.
Good job, Arun.
Thank you, sir. Thank you.
Thank you, sir, for sharing such practical insights that will undoubtedly benefit every postgraduate here. Thanks also to our moderators for their wonderful coordination and engagement. I now request the moderators to present the certificate to our speaker.
Yeah, please accept this certificate of appreciation, Dr. Arun.
Thank you, sir. Thank you, sir. Thank you.
Thank you, sir. And we'll now present the certificate to our moderators.
Thank you to the organizers, Dr. Subbalakshmi, for making a part of this, and also thanks to the ISPPD team, led by Dr. Varinder Goyal and the President ISPPD, for organizing such an exceptional event, the first of its kind, and making me a part of it. Thank you so much.
Thank you, ma'am. Thank you, sir. And thank you, Arun. And let me also say that, sorry, I made a small mistake with Arun's number of publications. He's crossed the half-century mark. Thank you. Thank you so much.
Moving to our final academic sessions for the day, we have a topic that resonates deeply with every postgraduate, striking the right balance, by Dr. Faisal CP, sir. I extend a warm welcome to our moderators for this session, Dr. Sonali Saha, ma'am, Professor in the Department of Pediatric and Preventive Dentistry at Sardar Patel Postgraduate Institute of Dental and Medical Sciences, Lucknow, and Executive Committee member of ISPPD. And I also invite Dr. I.K. Pandit, sir, Principal and Head of the Department of Pediatric and Preventive Dentistry, TAV Centenary Dental College, Yamuna Nagar, and Executive Committee member of ISPPD. I invite both of them and get the proceeding.
Thank you very much for introducing me and Sonali, and I feel happy if Sonali can introduce our most dear Dr. Faisal. Everybody knows him, a most handsome gentleman. And I give this opportunity to Dr. Sonali if she can introduce him.
No, sir. No, sir. Sir, pranam, sir. A very good morning to one and all. But I would request Pandit, sir, only to please introduce, sir. Please, sir.
I would definitely love to introduce such a gentle person, but I thought I will give this credit should go to you. But anyway, I will introduce nothing. So we all know Dr. Faisal, and he is called the most gentleman in our society. And he is presently the Dean Academics, Professor and Head, Department of Pediatric and Preventive Dentistry, Kannur Dental College, Kerala. He has done graduation and post-graduation from Raja Mutaya Dental College, Annamalai University. He is a member Board of Studies, Kannur University. Has done PhD in KUHAS University. He is also a clinical director, Special Olympics, Kerala. He has more than 100 publications in international and national journals, that are index journals. Has been awarded Fellow of ISPPD in 2021. Is also the IDN National Awardee for the Best State CD Chairman in 2022. Presently, he is the Vice President of ISPPD, and he has been instrumental in taking further so many programs of ISPPD whenever he is asked to do that, and he very meticulously does those programs in the society, and I wish him best of luck. And today the topic is very different. I am very keen to listen to this topic because what is inside the topic is he has kept it secret. So it must be very good for the students or people who are really aspiring to become periodontists. So over to you, Dr. Faisal.
Thank you, Dr. Pandit and Dr. Sonali.
Thank you, sir.
Boss voices. Please listen.
Respected moderators of this session and postgraduate students in pediatric dentistry. I'd like to thank the ISPPD for giving me a platform to the first MDS students who have joined various colleges across the country. First of all, let me begin by congratulating each and every one of you for beginning your journey as a postgraduate student in pediatric dentistry. You have stepped into a world where every smile you create can shape a lifetime of confidence in a child and a generation to come. Well, I have been told by the organizers of this event to talk something on a topic that is not written in your textbooks nor in your PG curriculum. It is a topic that is essential in postgraduate days and also the days after that. That is, this topic determines not only your success as a postgraduate student, but your peace of mind and your growth as a person thereafter. Well, as you begin in this new phase, you'll soon realize that postgraduate life is a delicate juggling act. Some of you will find it difficult to maintain the equilibrium. That is, maintaining the academic rigor with family responsibilities, deadlines with personal time, and professional aspirations with mental and emotional well-being. Too much focus on one side, you will risk burnout, and too little, you will lose direction. So the art lies in finding the middle ground where excellence and well-being coexist. And in the next few minutes, let us explore what this balance truly means in your context as a life as a postgraduate student, and how you manage your time, your emotions, your goals, and your passion, so that you only survive your first 1,000 days of postgraduate lives, but also thrive in them. The first year of postgraduate life is a period of transition. The workload can be intense. Between clinical postings, seminars, journal clubs, case discussions, synopsis, and first year exams, there is little time or there is little breathing space. Each day demands both precision in your duties and depth in academic understanding. Your deadlines can be endless, and balancing all these can be very overwhelming. Between all these, some of you might ask yourself, where do I find time for myself? How do I manage everything? Therefore, my dear postgraduates, the first lesson here is postgraduation is not about hard work, but about smart balance. So, dear students, accept this as a transition phase. The faster you accept this as a discomfort, as a part of this your growth, your smoother journey begins. In pediatric dentistry, learning happens as much in the clinic as it does in any classroom or in a seminar room. Plan your day in advance. Dedicate a minimum fixed time for reading your textbooks. Academics build your knowledge base and clinic redefine your skills. In other words, academics is where you learn why behind the things you do, and the clinics is the place where you learn how the things get done. So the key for you is to integrate both of these. So when you do your preclinical work, read about the basic things about it and have an adequate knowledge foundation about the materials you're working on. When you read about the behavior management techniques, try to do them in your next patient. Or when you perform a pulpotomy of a pulp therapy, go back and review the latest literature and understand why the materials work and how it is going to make a difference. This is how you integrate your academic and clinical work. And this is going to make things easy for you. Students, I want to emphasize and tell you that every clinical case is a potential seminar, and every seminar can improve your clinical decision making. You can learn a lot every day like this. That's how you balance your synergy. That is, your academic and clinical work strengthens each other. Let me reiterate once more. Prioritize your work. Make a schedule of work to be done daily. Learn to understand the difference between urgent work and important work. Your urgent work needs immediate attention, whereas important things can have a plan and schedule like your seminar or JC. Well, the research is part of your postgraduate journey. It may seem distant or abstract at first. It teaches you critical thinking, the ability to ask why and how rather than accepting what is written in your textbooks. At the same time, it is important not to let the research stress you out. Data collection, statistics, and deadlines can be very challenging, but they also teach you discipline and patience. The process itself makes you a better clinician because you learn to question, analyze, and improve continuously. Don't keep postponing your dissertation work. The stress is going to be enormous if you don't do your dissertation work on time. In post-graduation, we'll meet many challenges. Your failed restorations, a difficult child on the day, a tough questioning by your teachers, warning from your teachers, uncooperative character from your peers, etc., etc. But you'll also find success in your journey, so be grateful. Both moments, success and struggle, remember this, be confident and stay humble. Don't let the bad moments define you, let them refine you. Above all take all challenges with grace, grow through them with strength, and keep waiting with a purpose. Dear students, challenges are part of this journey. Don't be discouraged. Use mindfulness, mentorship, and peer support. Every challenge next few years is an opportunity for you to grow stronger and more confident and competent also. I believe that success in postgraduate studies is as much about mindset and skills. Embrace a growth mindset and see your challenges as opportunities to learn, accept mistakes, and be curious and proactive in all situations. Support from your peers and mentors are invaluable. Share knowledge, learn from each other's experiences, and create a collaborative and positive learning environment. Together, we can overcome challenges more easily. Dear students, in this postgraduate journey, it's easy to look around and compare yourself with others, their skills, their speed, their achievements. But remember, everybody's journey unfolds differently. Comparison often steals your joy. It makes you feel that you are not doing enough, even when you are actually making quite steady progress. What truly matters is focus, not comparison. Focus on your own path, your own pace, and your own improvement. And when you see others doing well, don't feel intimidated. Be inspired by them. Learn from their strengths and use that inspiration to fuel your own growth. Every success is a step forward, and celebrate all those small things. They may seem very minor today, but they are the building blocks of your confidence and your competence. Students, when we talk about striking the right balance during NDS, one of the most delicate part of that balance is between your family life and academic responsibilities. MDS is not just another course. As I said before, it's a period of transformation. It demands focus, long hours, consistency, and emotional strength. While your family is your strongest emotional support, you must remember that this phase of your life is to build your career. There will be days when you feel torn between personal commitments and professional deadlines. Family functions will be there, festivals, birthdays, all will come and go. And you'll be buried in your cases, seminars, and your dissertation work. So it is natural to feel guilty at times. But remember, this is a temporary sacrifice for a permanent gain. Your MDS is your priority right now. It is the foundation on which the rest of your professional and personal life will stand. If you give your best now, it will reward you for decades to come. But giving importance to your course doesn't mean that neglecting your family. Balance lies in communication and understanding. Share your challenges with them. Let them know when you are genuinely busy or stressed. Most families don't demand your time. They just want to feel connected to your journey. Even a few minutes of genuine interaction with your family will make a big difference. Call your parents, talk to your spouse, spend small but meaningful moments together. Let them see your dedication. They'll be your biggest motivators. At the same time, take care of yourself. Rest when you can. Eat properly. Don't burn out trying to be everywhere at once. Balancing is not doing everything. It is about doing right things at the right time. Remember, your family will be there always for you, but your MDS years will never come back. This is your chance to learn, to grow, to make a career shape and make use of it. And when you finally walk out as a specialist after 3 years, your family will be the proudest because they know every late night, every missed event was worth it. Or so, respect your family, stay connected, but give your course the importance it deserves. My dear students, our specialty, pediatric dentistry, is a blend of science with compassion and is always guided with empathy. So when a child comes to you for treatment, don't rush into doing treatment. Before that, build trust with them. For a child who is coming to your clinic, the fear is real, but remember your calmness is their comfort. Observe their posture, eyes, tone, and every clue that helps you to connect better. And use your smile, and it's going to be the best behavior management tool you have. A child won't remember your band placement or fluoride application or extraction, but they will remember how you spoke with them. So be empathetic to your patients. I am sure that your empathy and compassion gives you the connection and the balance in managing your patients. So often for postgraduate students, we teachers put pressure on you to get everything right. We expect you only to grow, to progress, and we know that perfection comes along with it. So perfection is not our goal. Our goal is to make you progress. Every mistake you make teaches you something valuable. Every challenge you face makes you stronger, more resilient, and more patient. It is these small lessons collected over time that shapes you into a confident professional. Remember, success is not a sprint, it's a steady, graceful climb. There will be days when you move forward and days when you barely move at all. That is normal. Growth takes time, effort, and lot of persistence. So don't be discouraged by setbacks. Don't measure your worth by somebody else's pace. So keep moving, one step, one more learning experience at a time. Because at the end of the day, success life is not about being perfect. It is about becoming a little better, wiser, and stronger with every passing day. So as you begin your journey, remember there is no perfect formula. Balance doesn't mean equal time for everything. It means giving the right things, the right attention at the right time. And there'll be chaos, there'll be long days, and there'll be moments of doubt in your journey. But in between all that, you'll also find joy, the joy of learning, the joy of healing, and becoming a kind of pediatric dentist who truly deserves to make a difference to the world. So be curious, stay kind, and be kind to yourself. And most importantly, keep striking the right balance. Thank you, one and all. Welcome to the world of pediatric dentistry.
Thank you all for the patient listening. Thank you, dear
Wonderful presentation,
moderators.
sir. No, sir, wonderful presentation. It
Thank you,
was
Dr.
really,
Sanani.
really so informative. Sir, a wonderful one. I'm sure all the postgraduates will be really benefited. Yes, the first years together with all, I think so. That's what. Thank you, sir. Thank you for the wonderful one. And I
Thank you.
thank whole ISPPD team, especially Shashikiran sir, Goel sir, and all the executive members of ISPPD, and my dear Subbalakshmi, whom we lovingly call Subbu Madam. And thank you. And I'm sorry for all the trouble I've given for not being able to join in. Thank you, one and all, and Team Malabar Dental College. Thank you so much for making me a part here. And any other questions? I would like Faisal sir to please.
It's a basket full
Sir,
of advice, so there won't be any questions.
Yes, sir. There are no questions, sir. No questions as of now. Yes, sir. Sir, I would now request the team to please give the certificate of appreciation to Faisal sir. Yes, sir. Congratulations. Thank you so much, sir, for being a part of this wonderful program. Thank you so much, sir.
Thank you. Thank you very much. Thanks, Dr. Subbalakshmi and ISPPD also.
Great job
Yes,
done
sir.
by Dr. Faisal.
Thank you,
And
sir.
really,
Thank you.
your this whole topic, I was all through listening patiently, and it was such a motivating and energy giving to the new incomers, new students, and really with your pieces of advice, I think they must be feeling in their hearts of hearts that is going to be a wonderful program. These 3 years in this specialty, and they are going to learn, and they are going to at the same time keep balance, how they have to keep their health and their family and their this professional life intact together. And it really piece of advice from an experienced person like you. And I think everybody must have really like. And at the same time, very thankful to Subha Lakshmi, who was always after me that I should be there. And I was yesterday traveling, so I requested her that my program should be in the last fag end up. Then I was lucky to coordinate Faisal's program. It was wonderful, different from rest of the people. And then really ISPPD, whole administrative team and head office, every time they look up to find some new programs and accept suggestions from the people, and it is going to be better and better every day. Thank you very much.
Thank you, Dr. Faisal sir, for that thoughtful and motivating talk. And now we'll present the certificate to our moderators.
Sir and
Thank you,
ma'am,
ma'am.
please accept.
Thank you so much. Thank you. Thank you, everybody. Thank you so much. Thank you.
Thank you, sir.
Thank you. Thank you very much.
Puneet,
Thank
can
you,
we-
sir. Thank you, Pandit sir.
With this, we come to the end of 2 wonderful days of orientation that we have had. And at this point, I would take 1 minute to thank everybody who have helped us to bring this program to this level. I shall begin with God Almighty, who has given us all the resources, right from even thinking and to start executing it. And in the execution of this program, the first person that we will have to thank is the head office of ISPPD. The moment we came up with a program like this, we were immediately, they said, encouraged us to go ahead and work on the program and gave us all the encouragement. Big thank you to the ISPPD HO represented by our dynamic president, Shashikiran sir and Virendra Goyal sir and the whole team of EASY members who have all been moderators and who have rendered all their support for all this program and all the endeavors. Big thank you to Dr. Rahul Hegde sir, who was our chief guest for the inauguration. He also readily accepted. Thanks are due to all the speakers. Everybody sent in their recording on time. Everything happened so seamlessly thanks to the big support given by all our speakers. This program would not have happened, would not have been effective. Whatever work we had done wouldn't have been effective if we did not get the first-year postgraduates to listen to us. So a big thank you to all the faculty and all the heads of the departments of pediatric and preventive dentistry across the country who have let their students to join us today, because these students might not have known the importance of these sessions but for you. Thank you so much for encouraging your students to join us for these 2 days. Big thanks definitely to all the postgraduates who have enthusiastically logged in and made sure that they attended this program. I would be failing in my duty if I didn't thank Pavni and Vasu from Uniglow. And definitely, I think I'll include Dr. Virendra Goyal also from that team, technical team, because Sir has been with it from the beginning. Sir has taken care of the Zoom. Sir has taken care of making sure that it goes online. Thank you so much, Sir. Thank you so much, Pavni and Mr. Vasu from Uniglow for supporting us through the program.
Thank you, ma'am.
Last but not the least, I would like to thank people back at home here at Malabar Dental College. I'd like to thank the management are my faculty in the department, beginning from Baliga sir, who has been a constant support through the whole program, and all the other faculty and colleagues here, and my dear postgraduates who've also helped in shaping out the program in the way that it has come. We definitely be looking forward to listening to your feedback and taking things further in, and we'll make corrections and come back to you. Thank you once again. Thank you so much for the opportunity. Thanks a lot, ISPPD team. Thank you, sir. Thank you all. See you all in Bhubaneswar. Sir, can we close this meeting, sir? Goel, sir? So I think...
Sir is not there.
Oh, okay, no problem, no
I
problem.
think so. We can leave now. Yes,
Yes, ma'am.
Dr.
Yes, ma'am.
Subbulakshmi.
Yes, ma'am. Thank you, ma'am.
Thank
Thank
you
you
so
all.
much,
Thank
dear.
you. Thank you.
Thank you. Thank you.
Ma'am, shall I end the webinar?
Yes, 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 yes. And then send me the recording, Kanna.
Yeah, ma'am.
Seriya?
Yeah, ma'am.
End it. No problem. Okay. Thank you. Big thank you, Pavni.
It's yeah, ma'am.
Ah, you're really good. I'll definitely call you sometime,
Yeah, ma'am.
for feedback and everything. Thank you.